I just want to, first of all, just thank all of you for joining us. It's another beautiful day in Washington with obviously a lot of fantastic news that we're hearing and seeing, and we're going to talk about some of that when it comes to vaccines with the news about Pfizer vaccine being available or eligible for those who are 12 years to 15 years of age for adolescents. Once that gets final approval, we're really excited about this news. So there's some really fantastic things that we're watching. But I want to, first of all, just remind everybody that we continue to be hopeful on the direction that we're going as a state and the trends that we're seeing. But we do want to make sure that people recognize that we are at this moment in time that we want to continue to see the trends going in the right direction. This includes our case data, our hospitalization data. Excuse me, one second. There you go. I had to clear my throat. So case data, hospitalization data, and the need to hold steady progress. And I think it really underscores the importance of vaccines. But before I start, let me first of all thank Michael Banse for, and I hope I pronounced it correctly, and I'm sure he's going to correct me if I didn't, Executive Director of the Asian Counseling and Referral Service, for joining to discuss behavioral health impacts of COVID-19 on Asian communities. As we all know, May is the Asian American Pacific Islander Heritage Month and Mental Health Month, and we thought it was appropriate to have an expert to speak on both the challenges of recent events on the Asian American community, as well as the mental and behavioral health impacts on our community throughout the state of Washington, but in particular with our OPI community. And so Michael was kind enough to join us today. So as we'll kick it off to him in a moment, but before we do that, let me start with giving some information on where we are as a state. As we know, statewide, the case counts began flattening in mid-April. We have now seen some hopeful signs of hospital admissions also appear to be flattening or plateauing as well. While we've still had over 417,000 confirmed and probable cases of COVID-19 in our state, and we've seen, unfortunately, almost 5,600 deaths, the measures that we have been putting in place as all of us, state and locals, all of our partners and our community members are really starting to slow the pace of transmission. While it is still increasing as of April 23rd, it's a slower pace than we were seeing in early April. That means that we're seeing a plateauing in hospitalizations. We're seeing a continuing of flattening in cases. And we do recognize that these are trends that are hopeful, but again, we have to continue to see those trends permeate, if you will, as we move forward. Variants that spread more easily continue to dominate. And so the variants of concern, notable, we've been seeing increases in the P1 variant, and Dr. Lindquist is on and can speak to that as well. We're getting a lot of questions about population immunity and this real concept of herd immunity. And I do want to just remind everybody, as I said on last week's press briefing, that our focus continues to be on the term robust vaccine coverage. What is it that we can have from a standpoint of coverage for vaccines that allows us to blunt the impact of COVID-19 and really make sure that we protect people throughout the state of Washington? I'm going to show that first slide, as I do every week, which is the three-legged stool, and just the reminder of the absolute critical importance of supply, logistics, and demand working together. While supply continues to be essentially flat, although we have some hopeful news that the federal government is allowing for states to be able to to order additional vaccine if necessary. We do believe we absolutely have the logistics and capability of vaccinating as we have worked on for several months, as many Washingtonians as possible. But it's really now starting to focus on the third leg of the stool, which is demand. And we have been seeing a softening of demand in not just certain parts of Washington, but in communities throughout Washington. And we want to do everything we can to encourage and incentivize Washingtonians to be vaccinated. We want the vaccine choice to be the default choice. We want people to make the right choice by getting vaccinated with COVID-19 vaccine. If I can show the next slide, it's the reminder that we have made an incredible amount of progress in our state. And I want to give our team, particularly led by Michelle Roberts and her immunization folks behind the scenes who've been working with partners throughout the state of Washington, an incredible amount of credit. We have now administered more than 6 million doses of COVID-19 vaccine, and more than 80% of the delivered doses within the state of Washington have been administered. And why that's really critical for us is that when we think about this concept of robust vaccine coverage, we estimate in Washington that about 35% of the population has some sort of immunity as of April 29th. That includes vaccinations or prior infections, 35%. But if I can show the next slide, we have provided vaccines to almost 3.5 million people who have received at least one dose of vaccine in the state of Washington. That means 57% of the eligible population, that means 16 years of age or older, and obviously that's going to change once you have eligibility for the adolescents. That should happen hopefully later this week. That 57%, more than half of our eligible population has received COVID-19 vaccine, at least one dose, and almost 50%, 46% of our total population has also received at least one dose of vaccine. Now, it's important as we think about community immunity that the threshold is difficult to estimate. We know that variants and how long antibodies last and all sorts of other factors are very much in play as we continue to vaccinate as many Washingtonians as possible. But I think it's important for us to know that we do not have to reach population immunity threshold alone to see benefits of vaccination. We're already seeing signs of immunity that's helping slow transmission and reduce strain on our healthcare system. If you remember, with the numbers that we are seeing with cases previously, our healthcare system would have been significantly strained. While we may be seeing some of that in certain communities, for the most part across the state of Washington, we have adequate capacity because of what I believe is the importance of vaccines. Now, experts in the public health field across the country, and you've even seen the study that highlighted what was happening in Israel, start to see steady declines in cases or transmission around somewhere of 40 to 60% immunity. So how do we know in our state that vaccines are working? Well, this is a graphic that I wanted to focus on. As you see on the right side here, the ratio amongst the population that is above 65 years of age or above shows that we previously showed that it was about 10 times more likely that someone who's 65 or older was who was unvaccinated was 10 times more likely to be hospitalized than if you were vaccinated. Well, this is the additional piece that we now wanted to show with our data folks who have now looked at the information, and we're now estimating that hospitalization rates in those who are in the ages of 45 to 64, so this is the left side of this graph here, who have not been vaccinated are 18 times higher risk for hospitalization than those who are fully protected. So again, let me repeat that. Those who are vaccinated are 95% more protected against hospitalizations than if you are unvaccinated. Unvaccinated people between the ages of 45 and 64 who have not been vaccinated, so they are unvaccinated, are 18 times higher risk for being hospitalized than those who are vaccinated or fully protected. So this is another reason we want to make sure that people in our state recognize the importance of vaccination and why reaching that robust vaccine coverage level is absolutely going to position us well for returning back to normalcy and bringing our state through this pandemic. Now, just this week, we've heard welcome news of the FDA authorizing Pfizer vaccine for those adolescents who are 12 years of age to 15 years of age. Michelle Roberts is going to speak to this in more detail. We know that ACIP and the Western States Scientific Review Committee is going to be meeting today. There are 378,000 kids between the ages of 12 and 15 in the state of Washington. If I could show the next slide. And that means that we have already fully vaccinated more than 2.6 million people in the state of Washington, we now have another 378,000 kids who are going to be eligible for vaccine. And we want to then encourage parents, once this vaccine is approved for adolescents, to really do everything they can to encourage their children to get vaccinated, and certainly to do everything they can to get them vaccinated. If I can show the next slide here, I want to highlight some of our efforts to assure equitable access through our vaccine tools. As we announced last week, we now have a COVID-19 hotline, which people can dial at 1-833-VAX-HELP. That's 833-VAX-HELP. And if we would ask our media partners to make that available, if you can, to our community members. It is available in English and Spanish. But I think here's the thing that I wanted to really highlight, that also there are the ability to handle 240 additional languages, which is just incredible to think about, especially at this time of equity, that we can have language, English, Spanish, and 240 additional languages, and those services being able to be provided to our community members. And I know that Michael is going to be speaking of the importance of linguistic and cultural aspects of how do we really bring together people who oftentimes are afraid to be a part of the system because they simply can't speak the language or understand the linguistic concerns that they may have in terms of questions for vaccines and beyond. The hotline is also accessible via 711 text telephone relay service, and also has deaf-blind interpretation technology. And as you know, our vaccine locator tool that's on our website is available in 30 languages, which I want to give an incredible amount of credit to our team, because if you remember when we first started, we had it in English. We were just starting to have it in Spanish, and we said we were going to build it out to have additional language coverage, and now we have 30 languages that can be utilized across the state of Washington to be able to determine where providers have accessibility for vaccines and where community members can get that vaccine. We've also been talking to our providers and our sites to make sure they're assuring accessibility. We know part of the challenge is not just in the softening of demand, is not just people that are saying we don't want to get vaccine, but we want to make sure the vaccine is the easy choice and make it easy for people to be able to access vaccine wherever they are. So we've asked our providers to work with us to make sure there's signage for people and there's adequate coverage for waiting areas, people allowing accompanying folks to come together. So if a provider has somebody, an individual who wants to get vaccinated, they want to bring somebody alongside with them, that they give the additional support so that individual can get safely vaccinated, accessible parking, wheelchair accessibility, and then vaccine communication card availability, as well as the availability of interpreters. There are a number of things that we're doing so that the provider sites are really welcoming people. So the experience that people have as they're coming in for vaccines, whether they are having challenges when it comes to languages or they have accessibility challenges, that providers are doing everything they can to advance equity and to be able to support that individual as they come in for their vaccine. We also know as weather improves, we want people to remember to follow travel and gathering guidance. Fully vaccinated people can travel domestically without testing or quarantine and gather with others who are fully vaccinated without masks or distancing. This includes outdoors and private indoor settings. And remember, we're talking about those who have been fully vaccinated, meaning 2 weeks after completion of their vaccination. Others should delay travel and keep wearing their masks inside and outside with people outside their household, especially if those individuals are unvaccinated. And everyone needs to keep wearing masks and watching distance, especially in crowded areas. And again, when you have concerns about vaccination status of those around you. But there's a lot to be hopeful about going into the summer. If we keep working together and getting more people vaccinated, we are making incredible amount of progress in the state of Washington. And so when we talk about vaccinating 3.5 million people already with getting at least one dose of vaccine and 6 million total doses that have been given to Washingtonians across the state of Washington, that means just an incredible amount of work that has already happened. But again, we want people to remember, be kind and remind, if you are vaccinated, we still need your help. Talk to your friends, your family, your coworkers, neighbors, anyone that you can get to a conversation about vaccination, why you got vaccinated, and why it's critical to helping our state move forward. Share information from reputable sources. We ask you to share information from our Department of Health website. Talk about your experiences. Offer help in finding or getting appointments, or getting to appointments, or transportation to or from appointments. And ultimately do everything you can so we have a culture of health. We also have a culture of vaccines and vaccinations. Ultimately, now is the time for everyone to get their vaccine. We have plenty of vaccine throughout the state of Washington. We want to make sure that both our providers and our community members remember the message, don't hesitate, vaccinate. And with that, I want to thank everybody for the continued work and efforts. Looking forward to the discussion that we're going to be having with our team members and including our guest, Michael. And with that, Corey, I'm going to turn it back over to you. Thank you.
Thank you, Secretary Shaw. Next, we'll go to Deputy Secretary Lacey Farabee.
Good morning, everyone. Thanks for joining us today. I'm here to talk about schools. Later this week, we'll release our health and safety guidance for the 2021-2022 school year. This is guidance to help private and public K-12 schools operate safely during the COVID-19 pandemic. We are releasing the guidance later in the week following the meetings of the CDC Advisory Committee on Immunization Practices and the Western State Scientific Advisory Committee, so that we can address the latest on vaccines for adolescents, as Dr. Shaw alluded to earlier. We are putting out this guidance pretty far in advance of the school year to help schools and families prepare for the fall. I do want to note that the existing guidance remains in effect for the 2020-2021 school year, and private and public schools should continue to follow that guidance, which remains available on our website. Now for a quick preview of what to expect for guidance in terms of summer and fall in K-12 schools. We are asking schools to plan to provide full-time instruction in person for all interested students with the following health and safety measures in place. The first one we know works really well: universal and correct use of face coverings in the school community, promotion of hand washing and respiratory etiquette, ensuring healthy facilities with ventilation, cleaning, and infection control plans, and then having a plan and being ready to respond to cases of COVID-19 when they happen. And that includes reporting to public health. It includes contact tracing, communicating with your staff, families, and school districts, as well as supporting students who need to receive instruction and are excluded from school due to illness or quarantine. In addition to those mitigations that I mentioned previously, physical distancing is recommended, and schools should have two plans in this regard. One that factors in the recommended physical distancing of 3 feet in classrooms and 6 feet elsewhere to the greatest extent possible and reasonable, while providing full-time in-person instruction for those families that want it. And then schools should also have a plan that does not have a physical distancing requirement. And this is, partly because we are pretty far away from the school year in terms of pandemic time. So we're asking schools to have both of those plans, and we will keep them posted over the summer as we monitor the science and course of disease and vaccine uptake in our state. COVID-19 testing programs and vaccinations are additional layers of prevention that we recommend in schools, but not a requirement for providing in-person instruction at this time. These measures do greatly help reduce the risk of transmission in schools and in the broader community. DOH has a testing program called Learn to Return, and it was recently expanded with funding from the Centers for Disease Control and Prevention. This program provides schools with a menu of options to support testing in or near their school campuses. And that includes responsive testing for people who have symptoms or are close contacts of someone with COVID-19, as well as repeat testing, also known as screening testing, or surveillance testing. We work one-on-one with districts to really meet them where they are in terms of their school and community needs and capacities in this regard. We are currently supporting more than 100 school districts across Washington state with COVID-19 testing, and we continue to expand both the number of districts and the types of tests offered. So, any district that is interested can reach out to DOH, and we will be glad to help you with testing this year or plan for the summer or fall. I'm going to wrap up by saying, schools play such a key role in child and family well-being. They are foundational to child growth, development, learning, and health. And we've learned over the past year that schools are very good at implementing these health and safety measures, which limit transmission and protect the students, staff, and their families. We're really excited that the 2021-2022 school year can look a bit more normal, and that Washington's children have the opportunity for full-time in-person instruction. It is also important to note that a remote option will be available to those families who need it. We have the opportunity for full-time instruction largely because of these health and safety measures, and because of vaccinations and their incredible ability to protect individuals and our communities from disease. As you heard from Dr. Shah, we strongly encourage families to get their children vaccinated for COVID-19 as soon as they become eligible. And we encourage schools to work closely with local public health and vaccine providers to help families in their community, students and staff, receive the vaccine and get protected over the summer. Every single person is a step forward every single person who gets vaccinated is a step forward on our journey to recovery from this pandemic and gets us closer to a more normal school year next year. Back to you, Corey.
Thank you, Deputy Secretary Fehrenbach. Next, we'll go to Assistant Secretary Michelle Roberts.
Good morning, everybody. I'm Michelle Roberts, and I lead the COVID-19 vaccine planning and distribution team for the Department of Health. It's nice to be back with everybody this morning. I want to start by celebrating some of the numbers that Dr. Shah shared, but they're definitely worth repeating because we keep reaching a number of really important milestones. So today, when the dashboard updates this afternoon, you'll see that we've administered more than 6 million doses of the COVID-19 vaccine in Washington. And I think it's always worth making sure we're highlighting that most people are choosing to get vaccinated. In fact, 57% of all eligible Washingtonians have had at least their first dose, and more than 42% of people 16 and older are fully vaccinated. We are well on our way to protecting our community and using the power of vaccines to keep our communities protected. Our 4 state-led mass vaccination sites have played a big role as well. They've given out nearly 280,000 doses of vaccine. We've come so far, and all of this incredible life-saving work has happened in just 5 months. In fact, I think it was probably 5 months yesterday since the first dose of COVID vaccine was given in our state on Tuesday, December 15th. As far as this week, even more hope coming now that the FDA has expanded the authorization for the Pfizer vaccine for 12 to 15-year-olds. Tuesday's announcement was the first step in that process. The next step is today's CDC Advisory Committee on Immunization Practices meeting. And then tonight, the Western States Scientific Safety Work Group will also meet, review the data, and make a recommendation to the governors of those states. The CDC's Advisory Committee on Immunization Practice is the gold standard for clinical guidance for providers for how and who should be vaccinated. These two groups will give us recommendations and direction for vaccinating this younger age group. We know the Pfizer vaccine has been proven to be safe and extremely effective, and we're thrilled so many people are eager to vaccinate their children, myself included. Right now, we're encouraging parents and providers to wait to schedule their appointments until later this week to ensure we have all the information we need from these groups of medical and public health experts. As soon as they vote to recommend this vaccine for this younger group, we encourage everyone eligible to get vaccinated. The vaccine will protect our children and give us parents a peace of mind and maybe a little space from our children. It's the best step we can take to ensure our kids are healthy, remain in the classroom, can safely spend time with their friends, and take part in extracurricular activities, sports, theater, dance, whatever makes your child's heart sing. Those are all the things we want to increase what our families are doing and that we can do safely. We know and we hope we have more good news to share tomorrow once we know some of the outcomes of today's meetings. So let's talk about vaccine allocations and orders, because we've been getting a lot of questions about this lately. Our allocation forecast shows we'll be allocated nearly 400 doses of vaccine for next week. Orders haven't been finalized yet this week, but we know providers have been ordering less vaccine than in the past. And the CDC tells us this is something they're seeing happen across the country. There are likely several reasons why. Some providers already have vaccine on hand. Others are transferring when they have vaccine on hand between provider offices so they don't need to order more because they can share. Others know there's more vaccine available in the future, so they aren't ordering as much at the moment. And there's so much vaccine coming in through other channels as well, like the federal retail pharmacy program. And demand has also slowed down some. That's why it's important for us to continue to spread information, help answer questions, and make sure the vaccine is available to all types of locations, including pharmacies, your doctor's office, pop-up clinics, and more. Anyone who has not been vaccinated yet and is eligible can get a vaccine in Washington, regardless of where they live. Every vaccine that goes into the arm is good for everyone and helps protect us all. If anybody has questions and wants to know more about COVID vaccine, please visit the frequently asked questions page of our website or talk with your healthcare provider. The more people who are vaccinated, the more we all benefit as a community. And the data couldn't be clearer. We shared the hospitalization data that people who are vaccinated are better protected from COVID disease. And we still have high rates of disease in our community. The sooner more people are vaccinated and protected, the sooner we can get back to doing the things we love to do before this pandemic. Getting vaccinated is easier than ever before. Head to the vaccine locator to make an appointment today, or text your zip code to get vax, that's 438-829, to receive addresses of nearby vaccination sites, or call our new COVID-19 vaccination number, 833-VAX-HELP. Thank you.
Thank you, Assistant Secretary Roberts. Next, we'll go to Acting State Health Officer, Dr. Scott Lindquist.
Hi, in the interest of time and getting to questions, I'll just really emphasize one thing about the variants, and that is our number of isolates is mostly variants at this point, and the largest percentage variants is really in our B117 or the UK variant. That has become the largest variant in the state at 48%. The P1 variant that everyone has been concerned about has continued to grow, currently at about 11% of all our isolates. And the last significant variant of concern is the California variant, or the B1429, at 19%. We do see an increase in these variants, but we have not noted any trends in hospitalizations or deaths that are significant at this point. A little bit of increased hospitalization with the P1, but not any significant increase in death across the state in Washington. And with that, in the interest of time to questions, I'm going to hand it back to you, Corey.
Thank you, Dr. Lindquist. Next, we'll go to Director Michael Bion.
Good morning, everyone. I'm really grateful to be here on behalf of Asian Counseling and Referral Service to share important information from the Asian communities and the impact of COVID-19. As Dr. Shaw mentioned earlier, this month is the month of May, the Asian and Pacific Islander Heritage Month, and it's also Mental Health Awareness Month as well. In the midst of this pandemic, the Asian community faced unique challenges, as we are also seeing the rise of anti-Asian racism as a result of harmful words from the previous administration. Information shared by colleagues here at ACRS shows that anxiety and depression are high because in certain communities, there's historical trauma, especially for those who are former refugees. We are also seeing more American-born Asians who are seeking out mental health services given their unique identity and culture background. Substance use has also increased as community members are trying to find ways to cope with uncertainty. The rise of anti-Asian racism means that older adults and women are more afraid to leave their homes. While we are seeing promising uptake in vaccination within our community, the mental health and behavioral health impacts brought on by the intersection of COVID-19 and anti-Asian racism is still very concerning. And I really appreciate the Department of Health recently rolling out the multi-language support hotline to make sure that language isn't a barrier, which often can be really important in ensuring access for our communities. It's incredibly important for the broader community at this time to show support for the Asian community by speaking out against racism in all its forms, especially on social media. We are also encouraging community to take the bystander intervention training and learn ways to safely intervene when you see harm. For businesses, small and large, posting signs like Stop Asian Hate is another way to show support. Thank you so much.
Thank you, Director Bion. With that, this brings us to the Q&A segment of today's briefing. We do have a good number of media in with requests for questions today. If we're not able to get to your question, or rather you have follow-up, please reach out to us at doh-pio@doh.wa.gov. And also extending to our panelists that should we be able to, we may extend just a little bit to accommodate as many reporters as possible today. With that, I would like to open with our first question from, I think they've left the chat. All right, moving on. Steve with Como.
Hi, thanks for taking my question. I guess I have two questions. I think the first is probably for Dr. Shaw. Based on what you're seeing, are we headed in the right direction? I know that there's going to be a lot of attention about what's going to happen next week with the county phases. Do you think at this point, is there reason to move the counties next week, or would it be best to keep things as is a little bit longer? And then my second question is for Dr. Lindquist, I believe. What are you seeing in terms of recent COVID-19 cases in children? Probably we're talking about those under the age of 20. About what percentage of cases are impacting kids? I think nationally the number is about 20%, but in terms of what we're seeing here locally recently, what are you seeing?
Thanks, Steve. So let me kick it off with the first question. Again, you know that we're going to be running these numbers on Monday. So it's obviously premature to know where things are going to be by the time Monday rolls around. But I will tell you that, there are some hopeful signs, and I think that's the key message that we've been trying to share today, is there are hopeful signs that we're seeing flattening and plateauing in both hospitalizations and cases. We continue to monitor on a daily basis and are working with the governor's office and governor's team as we share that information to see what the implications of that are on policy, the broader policy. But at the end of the day, we're hopeful that these trends continue. If they continue and we continue to see the flattening and the plateauing when those numbers are finally back to us on Monday, then that obviously gives us hope that we're in a better place. I certainly am going to defer to the governor when it comes to any of the policies that come to reopening from that standpoint, because obviously it's going to be ultimately his decision. But I do think from a public health standpoint, we are encouraged by what we're seeing. But again, we're not out of the woods. We want to continue to emphasize that we've got to do everything we can to do all the preventive measures and also obviously continue our vaccination efforts.
Yeah, and this is Dr. Lindquist. To directly answer your question, about 17% of all our cases are in people 0 to 19 years of age. So we're a bit under the national average, but more importantly, really looking carefully at the variants and seeing, is there a predominance in the younger age group? And we have not seen that trend yet here. So coming with vaccination of 12-year-old and older, we're probably going to see even a decrease in the number of cases and variants. Has not been a concerning trend here in Washington at this point.
Our next question comes from Jessamine with Q13.
Good morning, and thank you all so much for your time. I have two questions, one for Dr. Shah and one for Dr. Lindquist. When it comes to the use of Pfizer in children 12 to 15, will those children have authoritative decision on whether or not to get the vaccine, or will parents have to sign off on that? Can kids just go get it on their own? And then for Dr. Lindquist, when it comes to the outbreak or the breakthrough cases we've seen in Whatcom County, how concerned are you when it comes to that potentially being due to variants?
Yeah, thanks, Jessamine. I'm going to kick that over to Michelle, but in general, obviously, that's the additional layer that is of concern when we now are not dealing with the individual who is eligible being the individual who's going to be getting vaccinated, but now we're dealing with the kids of a parent or a guardian who would be potentially getting vaccinated. So, Michelle, you want to talk a little bit about the consent process and how that's going to play out?
Yeah, in general, adolescents under age 18, so through age 17, do need parent consent for most medical procedures in our state, including immunizations. And so there's many ways providers can do that. Parents don't have to be present, but they do need to give their consent. And so they can get that consent written ahead of time, or there's a lot of options. There may be a few circumstances where adolescents don't need parent consent, including emancipated minors. And there's something in Washington law called the mature minor doctrine, which gives a healthcare provider a decision to make an independent decision that somebody is capable of and making most of their decisions independently. That's really a provider level decision to make that determination.
Okay, and so I'm going to answer your other question, which is how concerning are these variants and breakthrough? And so here, bear with me with this number. I don't know why I've got this memorized, but the number of breakthrough cases is 0.0003969. That is way less than 1%. So we are not having an unexpected number of breakthrough cases at this point. And when I look at those breakthrough cases and I look at the age group distribution, it's pretty equal across the age group. When I look at its distribution with vaccines, like was it more common in Pfizer or Moderna or J&J. And according to the amount of vaccine that's been given in the state, it's pretty well mirrors the percent of vaccine that's given. So we're not seeing a certain vaccine be more predominant. We're not seeing an age group be more predominant. And when we look at the variants from these groups, it is all over the board. The number one variant is 429, which used to be the most predominant variant, but we have P1, we have the B117, and we have many non-variant of concern or incidents. So the quick answer to this is we are not seeing disturbing trends. We are seeing what is expected in breakthrough with a vaccine efficacy that we have currently. Back to you, Corey.
Our next question comes from Nicole with the Cairo Radio.
Good morning. Thank you for taking my question. I'm wondering what you are doing to reach out to seniors who are homebound. I know that there is still a worrying percentage of seniors who had not gotten the vaccine. And if someone's stuck at home and doesn't have a car and perhaps doesn't have internet, I could see that being a real challenge.
Yeah, Nicole, you're absolutely right. A number of efforts that are really aligned with working with our local health partners, local health jurisdictions, and making sure that there's a connection at the local community level. Yeah, this is really continues to be a significant area of interest and concern for us, because we want to make sure that seniors in particular, regardless of who they are, where they live, or any other health or medical condition, that we get to them and get them encouraged to get vaccinated. Let me ask Michelle if she wants to add any additional detail there when it comes to homebound. But I do think it's critical that we do everything we can. And so that includes all of the different efforts that I highlighted before when it comes to the providers and our language access line, and making sure that we have neighbors or community members or family members that are encouraging that individual for getting vaccinated. But ultimately, if somebody is homebound, then really we have to take the vaccine to them. And that certainly is another piece of coordination with our local partners.
Yeah, as Dr. Sosh just said, now is really a time for creative solutions to getting people vaccinated and making sure vaccine is available where people are and when they are there. So whether that's community pop-ups or bringing vaccine to people. So that's happening every day in our state of vaccinating people who are homebound. So we are working to identify, people can self-identify and let their local health department or the state know if they're homebound. We're also looking at lists of people who are getting services that are homebound as well, to contact them directly. And as you mentioned, people may not have access to the internet. And it is a good thing that we have a hotline ready to go in multiple languages that has plenty of capacity to help people get their vaccine scheduled. So once again, that number is 833-VAX-HELP.
Michael Band, did you want to make a comment about the OPI community when it comes to encouraging vaccines, especially for seniors?
Yeah, thank you, Dr. Shaw. I think one of the things that's really important is the power of word of mouth and how family connections and seeing other family members get vaccinated. So for our older adults, they really rely on that connection to make an informed decision about whether they move forward. Fortunately, as local data here in the King County area shows that vaccination uptakes among Asian communities are pretty good. And so I think we just need to continue that path and encourage and provide information, accurate information to our community members so that they can make an informed decision about getting vaccinated.
Thanks.
Our next question comes from Arielle with the Spokesman Review.
Thank you. I'm curious how the Department of Health is ensuring there's enough Pfizer in each county to get to kids ages 12 to 15, and how important school districts will be to ensuring that teenagers and students that now have access will get access to the vaccine in the coming weeks. Thank you.
Thanks, Sarah. Michelle, Lacey, why don't I kick that over to you?
Yeah, we're doing a lot to make sure we've made, with this week's vaccine shipments, additional Pfizer vaccine went to every county in the state. And we already know that there's around quite adequate supply, over 650,000 doses of Pfizer vaccine that are in the state at the moment. So there is lots of vaccine out there. We're also making it easier to search by vaccine type and make sure vaccine type is available on our vaccine locator tool, so it can help identify the places where Pfizer vaccine is. The last thing we're doing is really working within communities to identify sites where maybe vaccine could be depoted, which means that where it could be shipped to one place and then we can break it up into smaller segments and get it out to multiple partners. And that's really important with the Pfizer vaccine because we know the minimum order size for an order of Pfizer vaccines over 1,000 doses, which is probably more than a lot of providers need at one time. And so that's why we're working on helping with sharing and transferring of one order of Pfizer vaccine. And just last final reminder, we've really transitioned to a demand-based system for vaccine ordering. So we're making sure providers understand that they should be ordering the vaccine they need, and we have plenty of Pfizer vaccine to support vaccine orders right now.
Our next question comes from Tom with Public Radio Olympia Bureau.
Thanks for taking my question. I was intrigued to see several other northern border states, including Alaska and North Dakota, decide to share surplus vaccine with their Canadian neighbors who seem to have a greater need for more supply. Have any of you had maybe even at least preliminary conversations about Washington sharing leftover vaccine with British Columbia? And maybe in any case, even if those haven't happened yet, would it be appropriate or plausible for Washington to help our Canadian friends on this?
Yeah, thanks for that, Tom. I honestly, as you know, I'm learning the binational relationship between our friends in Canada and obviously states like ours in Washington. And I actually, interestingly enough, have my initial discussion with my counterpart in British Columbia later today. So I'm actually going to be having some discussions just to have a better understanding of the different relationship aspects of things. Now, whether or not we can share vaccine, my understanding was that was more of a federal piece of this, but Michelle may have some more details of that. Certainly, we want to encourage everything that we can do to help our Canadian neighbors, and certainly we also recognize the importance of in order to fight this pandemic, end this pandemic once and for all, we have to work across the globe, not just in Canada or not just countries that are joining us, but across the world, everywhere that vaccine access and inequities across vaccine availability throughout the globe, which as we are seeing, for example, what's unfortunately playing out in India and other places, we are absolutely committed to doing whatever we can. But we also recognize that some of those are at the federal level. So Michelle, do you have any specifics about that when it comes to being able to share?
Yeah, we're not definitely, we can't be shipping vaccine over into Canada, but that if definitely somebody from Canada is in the US, the borders are largely still closed, but there are definitely reasons why, including industry and other pieces, shipping that Canadians may be in the US, and if they are here and vaccine supply is eligible, they can definitely be vaccinated. We know that's happening in some of our border communities now. We've gotten questions from providers in Whatcom County and others. And so as supply allows, we are already supporting of vaccination of any Canadians who are here in Washington.
Our next question comes from Charles with the Columbia Basin Herald.
Good morning.
Good morning.
I have two questions, and my first question involves, is there any reevaluation of the metrics, particularly the hospitalization metrics, by which counties are evaluated, increasing vaccination rates? And my second one is, Dr. Shaw, you just talked about defeating the virus, the pandemic, and a coworker reminded me that we're kind of in week 60 of 2 weeks to flatten the curve. Is there a sense that while we can deal with this, and that this may be a disease that we're going to be facing and coping and living with for quite some time, that it's not going to be easily defeated.
Well, first of all, Charles, thanks for your enthusiasm with the good morning. I really appreciated that. And I will say that, we do recognize that I'm going to feel a heck of a lot better with the answer to that question if we have more people vaccinated. I would feel so much better being able to say that even if we are going to need to live with COVID-19 for a long time to come, that is going to still not cause the amount of outbreaks, the length of outbreaks, the severity of outbreaks, and really the vulnerability of populations, especially our seniors and those who are most at risk. So I would feel a heck of a lot better saying that we are going to be living with this, but we're going to live safely with this because we are vaccinated. The challenge right now is that we're at that pivot point where we do not have enough people vaccinated, and so we still are seeing outbreaks, and we still are seeing surges and other concerning trends. Now, the fact that we are seeing improvements because of vaccines or flattening, plateauing because of vaccines, I think that's absolutely encouraging, and we want to see more of that. Whether or not this is continuation of something that we're going to be in for months or a long time coming, none of us know. I mean, it's all speculation. I mean, there are a lot of ideas in the public health community about we may need to be doing boosters. We may, have another wave in the fall or winter when influenza comes into play. We may have people whose behaviors have changed and decided that the pandemic is no longer an issue. We may have other surges. We may have variants. We may have a mutated type of COVID-19 virus that's going to also be in play. So there are a lot of factors that I can speculate on, and my colleagues across the country and the globe can speculate on. But in general, we know that we have to stay focused on what is ahead of us right now, which is that we do not have enough people vaccinated. We still are vulnerable as a state, and that's a big question and concern for all of us. I don't know, Scott, I know you've got to drop off in just a moment. I don't know if you wanted to take a crack at the second piece of this, or Lacey, when it comes to the reopening metrics.
Yeah, go ahead, Lacey. You're kind of the center point for this one.
Thanks for the question, and I'll ditto you. Thanks for the enthusiasm. We're always looking at the metrics, both what the data are telling us in terms of disease trajectory for cases and hospitalizations, and what the thresholds are. And I think we are really looking closely at our vaccination rates and how well we are protecting our communities with robust vaccine coverage. So yes, we are looking at all of those things to figure out our short and long-term journey through this pandemic.
Our next question comes from Steve with King 5.
Hi there. I had if someone could kind of detail the process today with the Western States Group, how that plays out, and also just vaccine hesitancy is still, of course, an issue that every health department in our state is dealing with. Is the expectation that with more people, i.e. kids, teens taking the vaccine, that might either help in closing that gap, or if it may extend those numbers out, or if it even plays a role at all?
Steve, thanks for the question. It's hard to know on that second one. We don't know how the opening up with adolescents is going to play out. Sometimes kids are very instrumental in influencing parents and adults to do the right thing and to get vaccinated in this case. So we had that around in Houston, and when it came to Zika a few years back, that it was the kids who were encouraging parents to make sure that there wasn't standing water in backyards, because they were hearing and learning about in school what the importance of was for mosquito borne diseases. So, I don't think we can underscore and maybe minimize the value of kids being able to encourage. But at the same time, as I mentioned, with 378,000 kids that are now potentially eligible coming this week, that just increases those who are eligible. But again, it's not going to solve the entire equation because it's still such a small proportion of the population. I don't recall your first question, but I'm sure one of my either Lacey or Michelle do, so hopefully they can answer it.
Western state process, the science group.
Yeah, I can answer that quickly. The group of the 4 states, everybody has members from the 4 states. That's Washington, Oregon, California, and Nevada. There's a meeting this evening of that group where they'll look at the data, and some of those members are also on some of the federal committees, including the Advisory Committee on Immunization Practices. So we'll look at the data and talk about what ACIP, and then that group will work on a written recommendations to governors, which usually comes out sometime the following day, midday. So that is the process. And then that will share that information publicly.
So Corey, I know we got 3 reporters to go. So why don't we just do rapid fire so we can try to get all 3 of them in.
Sounds good. Our next question comes from Evan with the Seattle Times.
Hi, thanks so much. I'm wondering, there's a clinic vaccine provider in Seattle who is already delivering and administering vaccines to 12 to 15-year-olds. Do they have the legal authority at this point to do that? Is that anything that's of concern to you all?
So, again, they shouldn't be doing that because, it has not been authorized yet. So we can follow up, Michelle, on that one.
Our next question comes from Eilis with KUOW.
Thanks so much for taking our questions. When you talk about robust vaccine coverage, do you have a goal for what percentage of the population or what percentage of the eligible population you want vaccinated?
Yeah, great question. Thanks, Eilis. We're actually having some internal discussions about what is that appropriate number, because it's a combination of obviously looking at what we think is going to prevent outbreaks and other aspects of the concerns, but also adding it into who may have already been infected. So we're looking at a number of those behind the scenes percentages. But I will tell you that it's higher than where we are currently. And so I think the focus that we have is to continue to vaccinate right now, because that gets us, again, every person gets us closer and closer to the goal that we ultimately have.
Our final question comes from C.E. Bick with South Seattle Emerald.
Hi, thank you so much for taking my question. I know it's a bit late, thank you. I did want to ask Secretary Shaw, I noticed that you told a reporter at the beginning of the segment that you didn't have enough data to say what Monday would look like, but the DOH and other state officials made a judgment on about 2 weeks worth of incomplete data to pause rollbacks in the first place, if I remember correctly. That's also what I recall a press release late last week, I think on Friday, said. Am I misunderstanding something?
Carolyn, thanks. I think it's just 2 different data points. So, even when we have data, it is only as good as the data that we have at the time, but we have not run the numbers, the information, and when we make a decision point, that decision point is the point that we choose, and in this case it would be Monday, to go back and look at where the information is, and then be able to make a decision on what the most complete data that we have. So if we make a decision today, it would be based on incomplete data, but it's also 4 or 5 days ahead of the actual time point that we're even going to be looking at that data set of data metrics. So we're premature because we're 5 days out, and we're also premature because we still don't have the complete data. So all of that is why we're geared up to have as much complete information by Monday as we can, analyze it, and then be able to make policy decisions based on it.
And this concludes the Q&A segment of our briefing today. Now we'll go to Secretary Shaw for closing remarks.
Well, first of all, I want to thank Michael Band for joining us today and for really just everything that you continue to do behind the scenes to really remind everybody of the importance of behavioral health and also the work within the OPI community throughout the state of Washington. So thank you for that, and your colleagues that are continuing to work tirelessly around the clock to help our communities of concern throughout the state of Washington. I also want to thank my team, my colleagues for helping answer questions. They always do a fantastic job. I also do want to close by recognizing that today is going to be the last day of Ramadan for a lot of Muslims across the state of Washington, across the globe. And I do want to wish everybody a happy Eid celebration for those who are celebrating tomorrow, but a reminder to Muslims and their friends to make sure that they celebrate safely and that they follow the guidance, because at the same time we are still in a pandemic, and we want to make sure that we remind community members of that. We've heard some reports of community members potentially ready to gather tomorrow, and if they're not vaccinated, they certainly will be put at risk, and we hope that those events or activities will be done outdoors as much as possible. So I wanted to make sure to share that message. And with that, I just want to say thank you to everybody. There are a lot of complex issues that we discussed today, and a lot of complicated factors that are still in play. We're doing everything we can to be as transparent as we can with the information, and also be as authentic as we can with the information, so that our community members can ultimately do what they need to do in order to protect themselves. We still have a lot of work to do for vaccines, but we're making progress. We're making an incredible amount of progress, and we're looking forward to the approval for the adolescents 12 to 15 later on, hopefully today or tomorrow, so we can continue to vaccinate Washingtonians and reach our goal. So with that, thank you so much. And Corey, I'll turn it back to you.
This concludes today's media availability. I'd like to thank our panelists for their time today, and TVW for hosting today's live stream and archives of past briefings. Thank you.